everyone. Once again, it's Dr. Saravana from Beyond Health Medical and Diagnostics. Today I'll be talking about smoking and cardiovascular disease. The leading cause of mortality in Malaysia is coronary heart disease. In 2018, number one cause of death in Malaysia is coronary heart disease. 18,267 deaths, which is 15.6% of all mortality, which equals to 50 deaths a day. Cigarette contains thousands of chemicals including nicotine, carbon monoxide, tar. Nicotine is an addictive drug that affects the brain and muscle activity. It's a vasoconstrictor, makes your blood vessel narrower, and this increases your blood pressure, making your heart work harder. Carbon monoxide, a poisonous gas that replaces oxygen in your blood, reducing the supply of oxygen to your heart and other organs. Tar is a sticky substance that coats your lungs, making it harder for you to breathe. Tar contains dozens of chemicals that causes cancer as well. So the risk of smoking is heart attack is more than twice as high as someone who does not smoke. Coronary heart disease is significantly increased if you are a woman who is on oral contraceptive pills. Stroke is more than twice as high as someone who does not smoke. Peripheral arterial disease, which can lead to gangrene, is increased by more than 5 times. How smoking harms the cardiovascular system? Like I mentioned earlier, all these chemicals in cigarette smoking causes the cells that line blood vessels to become swollen and inflamed. This can narrow the blood vessels and can lead to many cardiovascular conditions. Some of those cardiovascular disease are stroke, atherosclerosis, coronary heart disease, peripheral arterial disease, and abdominal aortic aneurysm. Atherosclerosis, in which arteries narrow and become less flexible, occurs when fats, cholesterol, and other substances in the blood form plaques that builds up in the walls of arteries. The opening inside the arteries narrows as plaques builds up, and blood can no longer flow properly to various parts of the body. Smoking increases the formation of plaque in blood vessels. Coronary heart disease occurs when arteries that carry blood to the heart muscles are narrowed by plaques or blocked by clots. Stroke is a loss of brain function caused when blood flow within the brain is interrupted. Strokes can cause permanent brain damage and death. Smoking can also damage other blood vessels. For example, peripheral arterial disease. This occurs when blood vessels become narrower and the flow of blood to the arms, legs, hands, and feet is reduced. Cells and tissues are deprived of oxygen when blood flow is reduced. Abdominal aortic aneurysm. It's actually a bulge or weakened area that occurs in the portion of the aorta, that is in the abdomen. The aorta is the main artery that carries oxygen-rich blood throughout the body. A ruptured abdominal aortic aneurysm is life-threatening. Almost all deaths from abdominal aortic aneurysm are caused by smoking. So, we have spoken about smokers. Let's talk about second-hand smokers or passive smokers. Exposure to second-hand smoke or passive smoking is a serious health hazard. Non-smokers living with people who smoke have about 30% increase in the risk of heart disease. Adult and children who inhale smoke from others are at increased risk of disease. It is also risky for children and babies. It increases the risk of sudden unexplained deaths in infants, bronchitis, pneumonia, asthma, and so on. So how do we overcome this issue? Simple. Quit smoking. Within 1 day of quitting smoking, your heart rate slows down, your blood pressure becomes more stable, carbon monoxide levels in your blood have dropped, oxygen can reach your heart and other parts of your body easily. Within 2 to 3 months, your ability to smell and taste improves. Your lungs starts regaining its ability to clean themselves, so you can cough up mucus. The blood flow to your hands and feet improves. Within a year, your lungs are healthier, you'll be able to breathe more easily. Within 2 to 6 years, your risk of heart attack or stroke drops significantly compared to if you continued smoking. The risk continues to decrease over time. Remember, save your heart, avoid the smoke. Your health comes first.